diseased kidney shows many different alterations when seen on a radiograph. Now, one such is the putty kidney. Now, what is it? This is a radiological appearance of dense dystrophic calcifications, often involving extensively damaged kidneys due to tuberculosis. Now, it is usually the end result of scarring, obstruction, as well as the atrophy of the kidney due to TB, which is complicated by dystrophic calcifications over a period of time. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to talk about a rare case study of a quiet putty kidney in a tuberculosis patient. Renal tuberculosis often goes underdiagnosed in most of the healthcare centers. Now, most patients, they have urinary tract infections, and only after a therapeutic failure directed against the usual bacterial urinary infections with persistent pyria associated with a negative urine culture often narrows down, that is, a diagnosis of renal tuberculosis is hence suspected. Now, a case study that was published in the Indian Journal of Medical Research reports a 35-year-old male patient who presented to the Department of Urology in the Northeastern Indira Gandhi Regional Institute with a 3-month history of pain on the right side of the chest after a blunt trauma. He suffered from pulmonary tuberculosis 15 years ago and had completed a full course of anti-tubercular drugs. Now, there was no symptoms suggestive of renal tuberculosis. He was normotensive and physical examination was unremarkable. The chest X-ray and urine analysis were also normal, and the plain radiograph, however, showed a dense reniform opacity in the region of the right kidney. The ultrasonography detected a contracted and echogenic right kidney with a strong acoustic shadow. Intravenous urogram as well as the renal scintigram demonstrated a non-functioning right kidney, which in terms is called as the putty kidney. So the patient was reassured and advised to undergo nephrectomy if it becomes symptomatic. So the authors concluded that patients with renal tuberculosis may have minimal symptoms and sometimes may even be asymptomatic, as in the present case was observed. Therefore, patients with a history of pulmonary tuberculosis should hence be screened for renal tuberculosis as well for the early diagnosis and the prevention of renal damage. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.